Welcome to Cambridge Health Alliance Health is Well. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And I'm excited to have with us today Libby Shrobe, who works for the
Institute for Health and Recovery.
Institute for Health and Recovery. And we are talking about an incredibly important subject today, and one which will probably surprise our viewers. We're talking about opioid addiction in older women. Older women as in?
As in 55 and up.
Older women are getting younger and younger every day. 55 and up.
Yeah.
Okay, so an opioid, we all know there's an opioid crisis, right? And there's a lot of talk and newspaper and TV focus on opioids.
Right, but the entire media focus seems to be on a younger generation, and really, you know, what I want to talk about today is that this isn't just a young person problem. And as the, opioid crisis continues to expand, it is really hitting everyone throughout the lifespan, including older adults and older women.
It's kind of shocking to think that. So tell us how that works. I mean, let us in on what medications, because I think they think of maybe sitting in the street and taking drugs. And it's not always that, is it?
Right, so we're talking about both illicit drug use like heroin, but we're also in an older age group, particularly in 65 and up. We're talking about a lot of prescription drug misuse and prescription painkillers. That's what opioids are, or also known as narcotics.
Such as?
Yeah, and so some of the names would be OxyContin, Percocet, codeine.
We're familiar with those.
Right, and so a lot of people are prescribed those medications both for acute pain, after surgery or after an injury, but then also people are prescribed those medications for chronic pain. So if you have ongoing pain that's very severe, a lot of people get this prescribed to them. And, for a lot of people with chronic pain, opioids are a really important resource. They're really useful and they help them function. And so they are, they have many benefits, but they also have risks. And so what we want to talk about and just, educate people about is that it's really important to be aware of the risks when taking these medications.
So what are some of the risks?
Yeah, so, one of the main risks, particularly as we get older, is that opioids can heavily increase your risk of falling and then getting fractures.
And the name of the game is to stay upright. We don't want to start falling and breaking.
Right, exactly. And I'm sure you've had people on your show talk about falling and fractures as...
Oh, lots.
Yeah, yeah. So that's a big issue. And, a lot of times when older adults fall and they go to the emergency room, they get screened around why they fell, but substance use and opioids aren't usually one of the things that people get checked on as to whether that was a cause or not.
And it's not a question that may come up?
Right. I mean, it depends on the emergency room. But generally, because there is this perception that older adults don't have an opioid use problem, it's not something people think about right away. Another risk is that it really causes extreme sedation and tiredness, and that can be a big issue, particularly because older women are prescribed so many medications that the interactions between those medications can really be causing a lot of sedation that's multiplied by the effect of the multiple medications.
Right, that's one reason I always recommend to people, always, to use only one pharmacy, because then the pharmacist may be able to catch some of that and alert them to some of that.
Absolutely, yeah, and you should always tell your doctor all the medications you're on, over-the-counter medications and prescription medications, because again, they'll be able to alert you if there's different interactions that could happen. And so, in talking about interactions and sedation, the biggest risk from misusing opioids is that in extreme circumstances you can overdose, which means that your body is not able to process the medication or the effects of the medication and the drugs, and your respiration, your breathing slows down, and that can cause brain damage.
Or even...
Or death,
Right.
So it's interesting. I think a lot of people, when they hear overdose, assume that it means death automatically. It doesn't, but that's the, worst of the worst scenario. But even people.
I don't know, it might be the best of the best in that situation.
Yeah,
Right?
it's not, yeah, so it's definitely a scary situation that no one wants to be in.
Right.
So, in making sure that we're thinking about the risks of opioid medications, that's really, the most extreme that we would want to combat and watch out for. And another thing I want to say about just some of the risks from opioid use is that a lot of people don't realize that drinking alcohol with their medications can be a really big problem. And particularly the combination of opioids and even just a tiny bit of alcohol can be really devastating. So, hopefully if someone's prescribed medication of opioids, their doctor warns them about this, but sometimes our doctors don't always have time to give us the full rundown.
True.
And so
True.
it's really important that people do not drink any alcohol while they're taking opioids.
Or it might be that special occasion that they say, well, I'll just have this one little drink, right? That could cause problems.
Yeah, because as we age, our metabolism slows down, and so then the alcohol is in your system longer and the medications are in your system longer. And so even though you think that they might not, meet up at the same time in your body,
They can.
they can. Yeah.
We don't want to take that chance.
No, absolutely not.
Okay, so opioid addiction, people can get addicted to these drugs.
Absolutely.
Right, because obviously they take care of the pain and they make them feel better.
Right.
You must get a little bit of a high with them, I would think.
Yes.
And that is a feeling that people may, maybe a little escape, that is refreshing if you're in incredible pain.
Exactly.
I can understand that.
Yeah, and that's one of the big risk factors, particularly for women. Women often use substances as a way to deal with psychological and emotional distress. And so research has shown that women are more likely to use substances in a coping way. And so particularly if you're prescribed them by your doctor and then they make you feel good, that can sometimes be a slippery slope.
Right.
And there's the kind of common mantra, well, they can't be harmful because my doctor prescribed them.
Or it's okay because my doctor.
Exactly,
Right.
exactly.
But then they could maybe start taking them more often.
Right, so when we talk about opioid misuse, there's addiction, like you were saying, but then there's also just other behaviors that fall under the umbrella of misuse. So that can be, like you're saying, taking more often than your doctor prescribed, taking a higher dose than your doctor prescribed, taking them with alcohol would be considered misuse because it's against the instructions of the medication.
And dangerous.
And dangerous, exactly. So there's a lot of sort of behaviors that can fall under this umbrella of opioid misuse, with the most extreme obviously being addiction. But yes, that is why the opioid crisis is the crisis that we are in, because these are very addictive medicines that, if not well monitored, can have negative repercussions.
Right, so if someone listening out there might find them, if they might say, gee, that kind of sounds like me,
Yeah.
then there are resources for them. yes?
Absolutely, yeah. So I would say that the best clearinghouse for resources, if you're worried about your own relationship with medication and opioids in particular, is to call the Massachusetts Bureau of Substance Addiction Services, and they have a helpline. And that number is okay if I share it?
Yes, absolutely.
Okay, so that number is 800-327-5050. Again, that's 800-327-5050. And that's a statewide hotline you can call and get resources that are in your area. I've called it just to check it out. They're very friendly, and you just sort of tell them what's going on, and they can say these are the resources in your area and give you the referral procedure.
And it's okay. It's okay there's no shame in asking for help.
Absolutely. Addiction is a disease.
That's
It is a chronic illness, like so many other illnesses that we face, but it's been stigmatized in this way, unfairly so. And it's not a moral failing on anyone's part.
Right.
It is a biological disease that can change the chemistry of your brain.
Exactly. So, again, there's no shame in it. Please reach out if you feel that that we have described you and that you would like to have some help, because there is help out here.
Absolutely. There is help available. Would it be helpful to sort of talk about some potential treatment options?
Absolutely.
So, the main recommended research-based treatment for opioid use disorder, which is what we call addiction, that's the proper name for it, is what's called medication-assisted treatment. And so that is taking medication that has some of the same properties as opioids, but it eliminates the addiction aspect. So it helps reduce withdrawal symptoms,
Okay.
because if you stop taking opioids after using them consistently, you can get really bad withdrawal symptoms, like flu-like symptoms.
Okay.
So you don't want to do that. You don't want to just cold turkey.
Okay.
So the medication-assisted treatment helps you slowly taper down off the medication, but it eliminates the characteristics of addiction, so the cravings and the seeking of the drugs.
So they might do it simultaneously and then decrease the opioid?
Right,
Yeah.
exactly. So you take them you would start going to the medication-assisted treatment and get that. There's different types, so there's methadone clinics.
Oh, yes.
Which those you go daily and you get a daily methadone dose. And then you also have treatment and behavioral counseling and, group support and whatnot. There's also office-based medication-assisted treatment. So Suboxone is often the brand name used, and that is used in, primary care, and you get a prescription and you can take it home with you.
No.
And so with all medication-assisted treatment, it should always be paired with counseling and behavioral therapy as well. But that combination is really the frontline treatment for opioid addiction.
And they would always make sure that you had those resources available.
Absolutely. And here in Cambridge, there is a methadone clinic. Cambridge Health Alliance offers these services. They
Right.
have office-based medication-assisted treatment services. And so right here in our community, there are those options available.
Good. And with all of the case managers, social workers, and all the appropriate disciplines that you might need to help you through this.
Absolutely, yeah. And I think, one good thing about the opioid epidemic really being in the national news is everyone's really aware of the resources now, and, they know where to look. And so it makes accessing treatment somewhat easier.
Right. Wow. So what else do we have to talk about with the opioid? Do we have?
Well, we could talk about some of the effects that opioids have on older adults and older women in particular. Maybe not that they are misusing opioids, but how it being an issue affects them.
Oh, yes. Okay. I think that's a good one. Let's talk about that.
Okay, so opioids are obviously also affecting younger adults, as we've heard, and something that really has been coming to the forefront as an issue is that if adult children are addicted to opioids, that can be a big problem for their older parents or older adults who are maybe, loved ones and supporting them. So there's sort of two...
Or even grandparents.
Yes. There's
Right.
sort of two main ways this can affect older adults in that sense. One is if you are prescribed opioid medication and you keep it in your medicine cabinet, sometimes people will take advantage of that, and when they're over to visit, they'll come and steal the medication so they can either sell it or misuse it themselves. So that's a big issue because you might accidentally, without even knowing it, be supporting someone else's negative behaviors. The other issue that we've been hearing about a lot is that, people are caring and we want to support our loved ones, and if you have someone in your life who is suffering from addiction, you might let them come into your home and, wanting to be supporting them, but they might be using in your home. And in that case, that can really put your own housing at risk. And so that's a really big concern because particularly as we get older, our options if we're evicted from our housing are either nursing homes or the streets.
Right, or the shelters,
Right.
yes, which is definitely, my understanding of the shelters is that you have to take all of your belongings with you every day, leave the shelter, and then go back at the end of the day to see if there's a bed for you. So
Exactly.
you're like a turtle, you're dragging everything around all day
Right.
long.
Right. And no one wants to be homeless, obviously, and the upset of being ripped from your home and then, like you're saying, having to be transient can be really devastating.
Right, the other thing, I know it's hard because our heartstrings pull, and we don't want to turn anyone in, especially those that we love and care for. However, if we are at risk for losing housing, then we're not going to be able to help anyone. So we need to take care of number one first. That was a hard lesson for me to learn, decades and decades and decades. But we have to stay strong ourselves and make sure we have everything for us, so we can be there to help other people.
Right, exactly. So sometimes even though it feels like the wrong choice and it feels mean and like you're ostracizing, in the long run it can be better to not let that person into your home, because then, like you're saying, you can maintain stable housing and then have that, you know, the stability to offer your love and support in other ways to this person.
Right, right.
Yeah.
So if medication is being stolen from you, you know, it might be one or two at a time. It might not be so
Right.
noticeable.
Right, so one thing to do that pharmacists recommend is to count your medications every 2 weeks. So that way you have a sense of how many medications you have and how many you should have, you know, after you take the appropriate dose. And counting them every 2 weeks is supposed to sort of include the potential that you might miss you might, you know, drop one, you know, some might go missing just from happenstance. But if you're noticing a large amount missing every 2 weeks, that's an indicator that someone might be taking them. And so then what we tell people to do is that you should lock up your medications. You can buy a medicine lockbox. You can get them at your local drugstore. And
Like
then
at CVS or
yeah,
Walmart?
at a CVS, exactly. And then to store that lockbox somewhere other than your medicine cabinet. Because obviously if someone's looking for medicine, they go to the medicine cabinet.
Right.
So, so yeah, there's this catchy phrase, count it, lock it, drop it, which is a good prevention effort. So you count your medications, you lock them up, and then after you're not using them, so say, you know, you don't need your medications anymore, you're not in pain, you stop taking them, what do you do with your leftover medication? Don't leave them in the home, because that is the potential where people can come in and take them. So you can drop off your medication, any medication, at your local police department. They have a 24/7 drop box in the front lobby, so you can bring your medications and come drop them off, and then they're out of your hands and they get disposed of safely. The other thing is certain medications shouldn't just be flushed down the toilet or thrown in the trash, because they can have different biological effects. So if you drop them in the drop box, they get taken care of in the appropriate environmental way.
Right, and there are no questions asked, you can just put them in.
Exactly, and so that's anything, you know, it's vitamins, prescription medications, whether they're expired or you just don't need them anymore, pet medications.
Well, that's a good
You know,
point, never think of that.
Right, drug samples. The only thing they don't take is liquids.
Oh.
So yeah, so that's one thing that you cannot dispose of in the drop-off boxes.
Oh, okay. Well, since there are some liquids, but most medications come in pill
Exactly.
form. So
Right.
I guess we're okay with that. Now, were we talking about some sleep medications as well? We mentioned
Yes,
that.
yeah, thank you for bringing that up. So, benzodiazepines, which are things like Ativan or Xanax or Klonopin, which are often prescribed for anxiety or to help people go to sleep, those medications can be really dangerous when combined with opioids. They are also a sedative. They make people sleepy and tired, and so do opioids. So combined, they can cause an overdose very quickly. And there's been recent statistics in Massachusetts that show that I believe over around 50% of cases of opioid overdoses also included benzodiazepines were found in people's systems.
So it's definitely a danger there. And not to mention, since they both make you slow and tired and sluggish, that again, the increased chance of falling and breaking.
Yeah.
And
And if you're driving, traffic
driving.
accidents.
Mhm.
Yeah, so even if you don't overdose, they can have other really negative effects.
Exactly, you could injure yourself and others along the way.
Yeah. So yeah, there's a lot to remember around opioids and, you know, what to do and not do. I mean, I would say the main thing is follow the instructions of your doctor. And, you know, if you are hearing this and considering, you know, that maybe you want to talk to your doctor about your opioid medication, I would absolutely encourage that. And I definitely want to say you should always talk to your medical provider and prescriber before changing your medication routine.
Yeah. I do know that sometimes if there's any suspicion that of misuse, or if someone might be taking it, a child or a grandchild, that sometimes doctors will dole out a week at a time.
Right.
And sometimes they do that to sort of restrict and make sure that the person that it's prescribed for is the one that gets to use it.
Exactly. So
And if not, and you're the one in pain, then you're going to be in a lot of pain until your next prescription.
Right, and that's another reason to lock up your medications, is because if you lose them or if someone takes them, you oftentimes can't get an early refill.
Exactly.
So then you're stuck in pain. Yeah.
For the duration.
Right,
however long that
exactly.
will be. Yeah.
Exactly.
And that's not a fun thing.
No, no one wants that.
So, I think we were, there was the treatment center, but then weren't there other resources that we were going to talk about?
Yeah, so I mean the drop box for dropping off your unused medication is at the Cambridge Police Department, so that's a good resource if you have extra medications you want to get rid of and get out of the house. The address for the Cambridge Police Department is 125 6th Street, so if you can make a trip over there, that'd be great. The other thing is, this Thursday we're having a take back event, which means we're taking back medication at the Cambridge Senior Center. So that is February 22nd. And it is from 1 to 2 p.m. at the Cambridge Citywide Senior Center, which is 806 Mass Ave. And so if folks want to come and drop off their medication there, if that's closer to home and easier than the police office, that's a great place to do that. And we'll also be talking about this issue more if you want to come learn about it. So those are two great ways to get rid of some of the unused medications. The substance use addiction services line that I mentioned earlier, the hotline, is a great resource. And then if you know someone who might be struggling with addiction, who you're worried about, a loved one, friend, family member, there are resources available for you to help support that person. So there's two really great resources that I think are important to mention. Learn to Cope is a network of support groups that are run by family members of folks affected by addiction. And so that's a place to go and get support from other people who are facing similar issues and who have been through it.
Typically, are they scattered throughout the state?
Yeah, so I know there's one that is held in Cambridge, and then you can look at their website. It's Learn to Cope, to like the number, and that lists all of the meeting times and locations. So
is there any means, if someone cannot get out, if mobility issues or whatever, transportation, health-wise, can they? Is there a phone? Are they able to just get someone to talk to and counsel for that? Is there any provision for that?
I'm not sure if Learn to Cope has that. I know that if you were to go on their website, they do have a phone number, and so you could ask. I think Learn to cope is facilitated by peers, meaning people who have been in that situation before. So perhaps a peer would be willing to do some over-the-phone counseling.
Yeah.
The other option, if you can't go outside or get to another location, is there is a great resource online called Allies in Recovery, and that is a online community for people who have loved ones who are facing addiction. And so it is both a resource. They have trainings and news articles and videos about how to interact with someone who is high or someone who's using, and sort of how to talk to them in a research evidence-based way. And then it's also, there's forums, there's like chat rooms, and so you can get support from other people facing that issue. And if you have questions, you can send them an email and they'll send back suggestions about potential strategies to use.
Well, that's good. So there are treatment options there. We only have another minute. And also, if you are the one that medication is being taken from, it's actually a form of elder abuse.
Yep.
And you can report that to Protective Services in this area, Somerville, Cambridge Elder Services, or in any area that you might live in, called the Elder Service Agency. So that's also an important point for people. There is help out here, but we have to be willing to take it.
Yeah.
And we aren't always willing to take it.
Right.
Right.
And the first
Those heartstrings pull tight.
Right.
I know. Right.
And I think, like you said, the first thing towards taking a step towards help is realizing that this is a problem that could affect all of us and any of us, and it's not your fault, and it is a disease, and it can be treated.
Right. And there is lots of help out here at the Cambridge Health Alliance and other, I'm sure, hospital organizations
Absolutely.
around. Yeah.
Yeah.
So you're working with the Alliance, are you?
Yeah, so we're doing some prevention efforts with Cambridge Health Alliance around this area. We're training some social workers and doctors around prevention efforts, and then we're also going to be offering some education around these issues for older adults themselves who get care at Cambridge Health Alliance.
Well, this has been very enlightening, and I hope you have learned. I always learn on this show. That's why I keep doing the show. So thank you so much.
Thank you for having me.
I appreciate it, and hopefully someone out there will be able to receive some help because of it.
Absolutely.
Thanks so much.
Great, thank you.